Hello, everybody. My name is Renata Nami. I'm a certified Orofacial Myologist and the founder of Airway Circle. We are so excited to have you here today because we have two very special presentations for you. One, Angela Richwine, a good friend of mine, has put together a myofunctional therapy screening tool with Dr. Stephen Lamberg, and it's called S.W.A.L.L.O.W.S. Stay tuned. She's going to go through what each single letter means and how you can use that in your own practice. Second presentation, Tamara and I go into detail on how to become a myofunctional therapist. Would you like to take your first, second, or third myofunctional therapy course? Airway Circle has put together 15 weeks of content with incredible speakers, guest speakers, and special lectures just for you. So click on this QR code, where am I? On this QR code right here. So you can get some more information about Foundations of Orofacial Myofunctional Therapy, our Myofunctional Therapy University first course. We hope you enjoy the show. Bye-bye.
Hi, my name is Angela Richwine. I'm an orofacial myofunctional therapist, and in collaboration with Dr. Steve Lamberg, diplomate of the American Academy of Dental Sleep Medicine, together we created a myofunctional risk assessment tool for sleep-related breathing disorders called S.W.A.L.L.O.W.S. I will go into the acronym of what S.W.A.L.L.O.W.S means, but first I'd like to dive into this quote. It was from a literature review on myofunctional orofacial examination tests. Myofunctional orofacial examination is an important tool for the assessment of the stomatognathous system and orofacial functions and the early diagnosis of orofacial myofunctional disorders. Many functions that are essential and sometimes characteristic to humans are performed by the stomatognathous system. These include speaking, chewing, tasting, swallowing, laughing, smiling, and yes, kissing. But why should we have another screening tool? We have so many here listed, and there are more. We have right now the Ferris 6, which was recently released +4, the nasal obstruction symptom evaluation, NOSE, Chicago Hearts, and that is for pediatrics, Brooms, and that's for pediatric and adults, the Lamberg questionnaire, which is up to now version 16, and that's for adults. We have the PSQ, sleep-related breathing disorder for pediatrics, and we have the Stop Bang. And again, let's ask, why another screening tool? And the answer is simple. The more tools we have, the more awareness we can provide. These tools are non-invasive, they are effective, they are inexpensive, and they're very easy to use. What does S.W.A.L.L.O.W.S stand for? S for strain. We're looking at the perioral muscles on swallow or on lip closure. We're looking for the width of the palate. We're looking for the airway mode, oral or nasal. We're looking at lymphoid tissue, the tonsils and the adenoids, although we can't see the adenoids while just opening the mouth, but we can assess them on a CBCT scan, or we can refer out to an ENT or to someone who has a CBCT scanner, and they can see them. We look at the labial and the lingual frenum, at the function of them. We look for the ocular signs. Is there sclera under the eyes? Can we see them? Can we see it? And then we look at the venous pooling, if there is any, or any allergic shiners. We look for the wear on the teeth. And we also look for scalloped borders of the tongue. Let's jump into the first S, strain of the perioral muscles. Is there any mentalis strain going on? These are the things that we look for. In order to study the function of the level of activity of the mentalis and the orbicularis oris superior muscles in subjects with different lip morphology, an electromyographic investigation was carried on to 10 with 10 on 10 children and with normal lip position with competent lips, and 10 children with lip incompetence. The underlying skeletal and dentoalveolar morphology was studied by cephalometrics. All of the children had malocclusions and had received no orthodontic treatment. It was found that a relaxed lip position with no EMG activity could be taken up by all of the children in both groups. Lip closure, mastication, and swallow were performed with a significantly greater activity in subjects exhibiting lip incompetence than in those with normal lip position. W is the width of the palate. The aim of this paper was to assess the morphology of the maxilla and the mandibular arches on 3D casts and to correlate these measurements with the severity of obstructive sleep apnea. If you take a look at these two pictures, you can see that we're looking at the palate with two different types of measuring devices. If you don't have a CBCT scanner, that's okay. Now these are approximations, which is better than nothing. And it's very simple. Most dental offices end up having a cotton roll. And if you place them between the the palatal surfaces of number 3 and 14, the average cotton roll size is 37 millimeters. And if the cotton roll, when you place it between these two molars, the two first molars, if the cotton roll bends upwards towards the palate, then you know that that cotton roll is just not fitting between those two molars. So that means that there's a narrow palate. You can also use a handheld digital caliper or just a handheld caliper, and that will show you the measurement of the intermolar width. Where you take the measurements when you use a caliper is the mesiolingual gingival line angle of the mesiolingual cusp and at the gingival line angle. So you use the tips of the device and you place them against the line angle, and you can, if you slide it palatally, you can feel a little indentation, and that's where the CEJ, cemento-enamel junction, is located, and that's the connection of the tooth crown to the root of the tooth, and that is where you want to get your most accurate measurement and your reading from. A is for your airway mode. Are we nasal breathing or are we oral breathing? And you can tell, are the lips sealed or are they apart? Healthy subjects with normal nasal resistance breathe almost exclusively through their nose during sleep. This study tested the hypothesis that a mechanical advantage might explain this preponderance of nasal over oral breathing during sleep. A randomized single-blind crossover design was used to compare upper airway resistance during sleep in the nasal and oral breathing conditions. Upper airway resistance during sleep and the propensity to sleep, obstructive sleep apnea, are significantly lower while breathing nasally rather than orally. Upper airway resistance during sleep is significantly lower during nasal breathing than during oral breathing. In addition, to increased upper airway resistance, the oral breathing route is associated with a marked increase in obstructive sleep apnea severity, which is not related to coexistent central sleep apnea. The disparity, in upper airway resistance during sleep between nose and mouth breathing may contribute significantly to the predominance of nasal breathing during sleep. You can see in the third picture over the little boy who has the tongue depressor inside in between the lips, not biting on it, but just on the lips. If you're in a dental office or any medical office, you can check nasal breathing, nasal passage. Is there one side more blocked than the other, or are both sides blocked, or do we have full nasal patency? And by doing this, keep the lips sealed around this tongue depressor. And for 3 minutes, you breathe 1 minute without blocking the nostril, 1 minute blocking one side, 1 minute blocking the other side. L for lymphoid tissues. Evaluation of the manuscripts published in this article in the last 20 years showed that adenotonsillectomy is the first line of treatment in most patients with adenotonsillar hypertrophy, but medical therapy in children over 2 years old with mild OSA is a valid alternative. Obstructive sleep apnea syndrome, OSA, is the main manifestation of sleep disordered breathing in children. Untreated OSA can lead to a variety of complications and adverse consequences, mainly due in intermittent hypoxemia. When adenotonsillar hypertrophy is suspected, a good analysis must be collected to assess mouth breathing, snoring, dysphagia, headaches, dyspnea, frequent awakenings during the night, somnolence during the day, enuresis, also known as bedwetting, difficulty concentrating, poor school performance, or even poor work concentration, just to name a few. Upon physical examination, one could find the typical adenoid face, which is characterized by a long, lean face with an open mouth, high arched palate, underdeveloped maxilla, a short upper lip. It could be all connected also to tethered oral tissues. Evaluated nostrils, which you can evaluate the nostrils with the nasal salute, the allergic salute, and that is the hand going up to push the nose up, and you can see a little crease in the nose. And also dental crowding of the front teeth. You can use the Brodsky's or the Friedman grading scale, and that's used to compare the tonsil size. And you can see here that we have the Friedman and the Mallampati, but in the Friedman, you can see actually in the picture shown that we have about a grade 3 in the picture that's on the screen in front of you. And that is with the Friedman score. You can see that there's a little bit of space between the tonsils, reaching very close to the uvula. If surgery is not an option, there is also new research that you can look up supporting palatal expansion to create space for the tonsils. And if that interests you to find more information, information has been written up by Dr. Audrey Yoon and as well as Dr. Shireen Lim. The other L is for lingual and labial frenum. And we have a short, to talk about the short frenum, Dr. Christian Guilleminault. These have been associated with difficulties in sucking, swallowing, and speech. And it can lead to orofacial dysmorphosis, which decreases the size of the upper airway support. And also, it increases the risk of upper airway collapsibility during sleep. O for ocular signs. We look for venous pooling, allergic shiners, and also sclera, the white underneath the eyes when you're not tugging on your face like I am. Obstructive sleep apnea is highly prevalent in conditions characterized by fluid overload. Chronic venous insufficiency, CVI, is associated to fluid overload that might interfere with OSA occurrence and severity. Patients with conclusions in this here, according to the Berlin questionnaire, 59 patients had high risk of OSA. The predictors of having a positive Berlin questionnaire were male, body mass index, and symptoms possibly related to fluid shift. The conclusions are patients with CVI, a disease characterized by fluid overload, present high risk of OSA, which might be related to fluid shift. W for where. We're looking at the occlusal and the incisal edges of the tooth surfaces. This isn't just limited to the dental office. Any medical professional can see, even if not looking into the mouth. When someone speaks, you can see the teeth most often. And you can see on that very bottom picture there that those incisal edges are straight across. And normally unobstructed teeth are not straight across like that. The objectives in this article here: tooth wear is a common finding in adult patients with dental sleep disorders. The aim of this paper was to review the literature on the possible associations between tooth wear and the following dental sleep disorders: sleep-related orofacial pain, oral moisturing disorders, gastroesophageal reflux disease, also known as GERD, obstructive sleep apnea syndrome, and sleep bruxism. The conclusion: tooth wear is associated with the dental sleep disorders, orofacial pain, oral dryness, which dry mouth, GERD, and sleep bruxism. The dental sleep disorders are interlinked with each other, which leads to indirect associations as well, and makes the consequences of each single condition difficult to disentangle. Knowledge of these associations is clinically relevant, but more research is needed to confirm their validity. But research is coming, more and more. S, scalloped borders of the tongue. It's associated with pathologic polysomnography data and abnormal Mallampati grades. So a scalloped tongue occurs when the tongue presses into the adjacent teeth, which causes indentations to appear along the sides of the tongue, sometimes the front as well. When sleeping, you subconsciously push your tongue into your teeth and open up your airway. It may also indicate a narrow palate and inadequate tongue space. Here's the screening tool. It's very simple to follow and to read, and you can see that it's just a yes, no checkbox. The screening tool can be found on drlamberg.com, Dr. Lamberg's website, and also on my website at Central Virginia OMT.com. If you would like a copy of this, then feel free to reach out to me at centralvirginiaomt.com, or it's centralvirginiaomt@gmail.com. And at any time, you're welcome to reach out to me with questions. And I look forward to hearing from you. I hope that this has been helpful. I hope that there is, if not this screening assessment tool, that there is a screening assessment tool that you and your office can be happy using.
Welcome, welcome. It's Saturday morning and you guys are here with us to learn more about myofunctional therapy. What is this? How can you become one? Is it for everybody? If you guys are over here live with us, please tell us where you're from, what your profession is, if you're interested in myofunctional therapy as a career, or if you're just interested to know more about how this all works. So I can see my Instagram live. You guys can post questions over there and I will post them over here or ask over here for everybody. So, okay, ready? My name is Renata Nami. If you guys don't know me, I've been a dental hygienist since 2010, and I started studying myofunctional therapy in 2016, and I never stopped. If you are in this field, you know that it's one of those things you have to be so passionate about it, because one course is not enough. I said this earlier on my Instagram, that there's no standardized education in myofunctional therapy. So one course is not enough. That is just one point of view. However, I do believe that every course in this field is very important, and every educator in this field plays a very specific role. So please take more than one course. That's my, take home message. Number one over here, one course is not enough. However, with Airway Circle, we have 6 wonderful mentors, and everybody has taken so many different courses out there. And as a group, we came together and we said, you know, what do we wish that we would have had when we took our first course? So we put something together for you guys. It is the longest, the most comprehensive course in the United States. It's called Foundations of Orofacial Myofunctional Therapy. The QR code is right over here on the screen for you guys to go take a look at our landing page with way more information. It has all of the modules, everything that we're teaching over there. We have special lectures. We have guest lectures. So you guys can get more info there. However, today, Tamara and I are going to talk a little bit about our journey. How did we get here? What got us to fall in this rabbit hole of Airway and myofunctional therapy? Let me read what we have over here really quickly. Please put all of your questions here. Yeah, that was you. Hannah here from Colorado. We're going to be in Colorado this week.
Yes, this coming Wednesday we're going, yep.
Yeah. Oh, anybody here going to RDH under one roof, please let us know and come see us. Airway Circle has a booth on RDH under one roof. We're going to be taking some fun photos. Come say hello to us. I would love to transition from RDH to OMT in the next year. I would like to own my own practice out of my home. Oh my goodness. Yes, yes, yes. Super excited to talk about all of this. Before we keep going, I would love for Tamara to introduce herself.
Oh, thank you. So Renata and I actually have parallel careers, I would say, in myofunctional therapy, but didn't know each other probably till a few years ago. But in 2016, I also started exploring myofunctional therapy, mainly for myself, and realized like, wow, there's a lot of people that need this. And I feel like I need to talk about it. So my dentist actually said, do you want to study this? And I thought maybe, but I don't know where, I don't know how, I don't know the next step to even become a myofunctional therapist. So in 2016 is when I started. 2017, in the beginning, I looked for introductory courses, and there was like 2 that I could find. And it was very confusing. I couldn't figure out where to start. The whole journey has been really confusing, in all honesty. And that's, again, like Renata said, why we made this course. But I took so many introductory courses thinking each one had something different. And there are little nuggets in each one, but nothing was like coming together. And I had to figure out what I wanted to study next and spend lots of money, honestly, that too. It was not cheap to piecemeal everything together. So in 2017, I opened my business, Facial Physique. I'm in San Diego, and started seeing patients. And then in 2000, I'll just say a few years ago, because I can't know exactly, I added on an associate, and she sees littles, I see adults. They're different in many ways and same in many ways as well. And then, just grown. I'm passionate about helping other hygienists do the same thing, helping them figure out where to go. And so this course is going to put you into Myofunctional Therapy University. That gets you from A to Z and know all the things to become a good myofunctional therapist.
That's another thing that we thought was lacking in the field, a plan of action that covers everything. You know, when we first started, the myofunctional therapy courses out there were 28 hours long. Literally, you went somewhere for about 4 days and they crammed everything, and you left there with your head this big and still not knowing, how do I start? Where do I go? So actually, whenever we started Myofunctional Therapy University, we started with Myologist, didn't we?
We did, yes.
So we decided to create a course that guided people after taking their intro course and how to own a business, how to see patients virtually versus in person. And Myologist is now on demand, and it is part of Myofunctional Therapy University. And after that, we decided to, we still kept feeling there's still something missing. There's still something missing. And I am fortunate enough to be from Brazil and speak Portuguese. So I'm able to get all of the research. If you guys don't know, myofunctional therapy is #1 in Brazil, just because they are actually one of the only countries in the world that have a serious 2-year specialization, 500 hours in myofunctional therapy. Nobody else does that in a university setting. So I'm able to get a lot of the information and knowledge that I have now from there. So we decided to put a lot of that into an advanced course, which is called MyoCircle, that starts every January. So if you are a myofunctional therapist who has taken a few courses and you're still missing that link, that little link, that piece that goes from why are you doing what you're doing? How can you get faster results by targeting each muscle individually and understanding exactly what you're doing, what each exercise is going to do for your patient? Then join MyoCircle. And we've been doing MyoBiz and MyoCircle for some time. And then we're like, okay, we still need a first step into the Myofunctional Therapy University. How about the hundreds of messages that all the girls get weekly asking, where do I start? And we could never recommend us. We, just kept sending everybody to all these other amazing courses that are out there, but we could never, we didn't have an answer for them, So we decided to, get together and let's put something that will allow, like Tamara said, somebody to come in, take an intro course, then take a business course and take an advanced course. The whole program is about a year long. You're not going to find that anywhere else in the United States right now. So we do have Myofunctional Therapy University registered now. We are super excited about everything that we're going to be able to offer with it. But it's a community. It's a place where you're going to come. You're going to get to know other people that are in similar situations that you are, or similar places in your career. It's so interesting that Tamara and I started almost at the same year. I opened Myo Moves in 2018, and it was all online first. And then actually I'll see patients in the dental office on Saturdays for like evaluations, and then I'll do therapy online, and eventually became online. Once in a blue moon, I'll see people in person, but it's interesting how we've been. When did you graduate, Hygiene?
2009.
Okay, I was 2010. So we're right there. There's somebody. Yes, yeah. You're ahead of me.
We didn't know each other. Like through all the Myo stuff too, but not till later on did we meet each other. So I think the community is huge, especially the WhatsApp group. Renata, if you want to chat about that.
Yeah, so we have, every time we go through a course, we have a WhatsApp group. And we have mentors that are dedicated to helping everybody in the WhatsApp group. The difference of having a WhatsApp group and a Facebook group is that Facebook group, you put it out there and you wait for somebody, hopefully to answer. WhatsApp group, it's on your phone. People are constantly taking a look at it. And we have people in all different time zones in the world. So there's usually somebody awake that will, get to that question and answer. And your question might be somebody else's question. So people end up, getting to know each other. And we see with MyoCircle right now, once in a while, the girls will post that they met on a conference somewhere, or somebody was visiting a town and, one of the MyoCircle graduates was there and they met. So that's super, super exciting, the community that we're growing together, because there are plenty of patients out there that need your help. I think that this is the main reason why we're doing this, because we can't see everybody, We need to be able to share what we know, because we need your help. Our main goal has always been to help more patients. Our main goal has always been, how do we get to more people that don't even know that these things may be an issue? We need to educate more. So if you are a dental hygienist, a speech pathologist, a dentist, occupational therapist, physical therapist, first, if you just want to know more about the world of Airway, this is your first step. It's Foundations of Orofacial Myofunctional Therapy. We all know that if your foundation is not strong, your building will collapse. We always talk about, if your maxilla, if your foundation is not strong and you don't have that strong support beam, let's use that. The maxilla is the foundation, right? That's your first course. Your tongue is your support beam. It's our community. The Airway Circle community is your support beam. If you don't have those two in place and they're super strong, everything collapses. And we know how you feel as a brand new business owner not having experience with owning a business before, because most of us are clinical people. We're caring, we want to help, we want to do things, but how do you keep that going? Every day is super difficult. So having that community to fall back on, to be able to grow together, it is just insane. How many times do we get a new patient? We're like, I've never seen somebody like that before. What do I do? Just this week, I had 2 patients that had some genetic conditions that I haven't seen before. And they asked me, have you ever had a patient with this specific condition? And I'm like, no, I have not. But guess what? I have a whole community of professionals that I can go back and I can ask if somebody has experience on this. And if I don't, I refer to somebody else, So anyways, we're excited to have you guys. Let's talk a little bit about foundations. And in the meantime, if anybody has any questions, please let us know. Power Smile Dental Clinic, periodontist and implantologist from India. They did the breathe course and want to know more. This is it. This is where you find out more, when you understand a little bit more about how do the muscles relate to everything else that you're doing as a dentist, as an implantologist and a periodontist. I've been telling all my patients lately that we have 3 very important, it's a triangle, 3 very important points that we have to address. The first one is airway. So this breathing tube here has to be clear and free for airflow to go through. So that's why we work with ENTs. So they can take a look and make sure that tonsils, adenoids, lingual tonsils are huge. A lot of people are looking into that. Turbinates, deviated septum. Make sure that there's nothing blocking the air from flowing. The second pillar, so there's 3 pillars. Airway is one. The second one is structure. That's where we need a dentist, an orthodontist, to take a look to make sure that the maxilla has grown to its full potential, that this box is big enough to fit everything, right? So they're looking at skeletal structure, upper jaw, lower jaw. What can we do to increase the space? Number 3, third pillar is the muscle. This muscle has to be working properly. So it has to have enough tone. It has to have enough strength, and it has to know what to do. It has to know how to function. If you only address one of these pillars, the patient will 100% relapse. So if you have enlarged tonsils and adenoids, and then we send that child to get them out, there's research showing that in 5 years, if they had sleep apnea, they're going to have sleep apnea again. But if you address the skeletal structure and the muscle, guess what? No more sleep apnea present after 4 or 5 years. This is what research says. If you only do myofunctional therapy, we are going to get some improvement, but it's going to get to a point where you're going to hit a wall. That wall is the airway or the structure.
Mm-hmm. Yep.
I did have, I saw somebody on Airway Circle, we also have a group on Facebook for patients and parents to ask questions. It's called Airway Circle Patients. And you can join that as a professional if you'd like to contribute. And somebody asked there this morning that they were looking for a provider who did not do an RPE because the child has some neurological changes after the RPE. But my question is, of course, always why. I want to know why. There are some treatments and some approaches that have to be done a certain way, especially after the age of the child. This child is already 12 years old. At 12 years old, you need to apply a certain amount of force to be able to open the suture again, if you're not just going to remodel bone. So, of course, I want to know what kind of changes did this child have, and how fast did they turn the RPE?
Mm-hmm. Mm-hmm.
I know I'm going in a totally different tangent, but for those who do not know, RPE, rapid palatal expansion, it's usually a device that could be removable or fixed that goes on the roof of the mouth, and it has a key for you to turn. However, we should always ask ourselves, what makes an RPE an RPE? What makes it rapid is the number of turns and the frequency of turns. So you can have a palatal expander with a key, which you turn slower.
Mm-hmm.
still an RPE, consider an RPE, but you turn a little bit slower. So we have to ask these questions. It's not that RPEs are bad. We have to ask and find out exactly how often we're turning these. By the way, anybody here on the live right now that has seen the new Invisalign expander?
Yes, I have.
Do you have any patients right now, Tamara?
I don't. I've seen it, online, but I don't have any patients particularly that have it. Do you?
So I have 2 patients right now with the RPE. One is a 13-year-old girl who had crowding, and the other one is a 16-year-old boy who was just narrow. And both of them, I told the parents, I don't think so. I have never seen anything like this before. I was really against it. But they decided to go with it. And I said, okay, I talked to the orthodontist, and she was like, Renata, I've done it for 2 years. I was one of the trial doctors. I said, okay, go for it. If you've seen suture changes, that's what I want. I want that suture to open. If you've seen suture changes, go for it. And I am extremely impressed.
Good. So you're saying this is the Invisalign, not the RPE.
This is the Invisalign, what are they calling it? The Invisalign Rapid Expansion? No, Invisalign Palatal Extension is IPE. It's IPE, and I'm very impressed. So the 16-year-old got a huge diastema already.
Yay. Which is good. The diastemas are good.
He's changing the trays daily, and the younger sibling is not changing it daily. She's doing, I think, 2 or 3 times a week. So she hasn't gotten a diastema yet. So I'm not sure, I don't know exactly why the prescriptions are different, because of course I'm not an orthodontist, but it's interesting to see, even at 16 years old, that you would think the suture closed. How many times do we hear that? Even with an IPE, it's working beautifully. So if you are over here and you're a hygienist and you're a speech pathologist and you have not taken a myofunctional therapy course yet, you probably have no freaking idea what I'm talking about. But that is the benefit of walking with people on Airway Circle. In order for you to be or become a very successful and very good myofunctional therapist, it is so important for us to hear from different professionals, to learn what all these things mean, because we're going to be guiding our patients. One of our friends says that we are the quarterback of the whole team. Patients usually come to us first, and we guide them. So yes, now you need to go see a physical therapist. Now you need to go see, this different professional. Now it's time for maybe, consider sleep surgery. I mean, we don't know. But if I don't have any knowledge on what types of surgery they can do on the soft palate and what post-op looks like, I mean, I'm not going to know exactly what to recommend. So being part of a group like Airway Circle, if you guys don't know, we do have weekly lectures. We have over 200 lectures recorded already in our membership, and you guys are welcome to join it. If you just want to get your feet wet first, or if you're a dentist and you just want to learn more and not ready to take a full course yet, become a member. We have tons and tons of information in our portal for you guys. The lectures from 2021 to 2023 are all separated by topic. So if you want to know more about breastfeeding and oral ties, there are several lectures about that. If you want to know more about sleep, there are several lectures about that. If you want to know about craniofacial development, you just click on the craniofacial development. Tamara, do you want to ask that question?
That came through?
Uh-huh.
Yeah. So Lauren Woodall. Hi, Lauren. I think she's in our Myobiz. I think.
Yeah.
She says she's from Vegas. I have an airway patient at my office that is doing a hybrid of traditional expansion on the mandibular and the new Invisalign expander on the maxillary. Last week was the first time I had heard or seen this. I was worried about tipping the teeth and not getting actual expansion. Thanks for mentioning that you have seen good results. Good.
Yeah, 100%.
I think the other thing, Renata, was missing, why we created it, was the critical thinking part. That was missing in all of my introductory courses. And knowing, like, I see this, I do this. I see that, I do that. And then having the community to go back to it as well.
That is so true. And I teach this in one of our courses. You have you have myotherapy and you have myofunctional therapy. And for some reason, that is not distinguished very well in the United States. So myotherapy, it's like you go to the gym and you have a coach and they give you exercises to improve tone and strengthen those muscles. Deal? Myofunctional therapy, it's like you go to a physical therapist and they're going to give you exercises to improve tone and strengthen those muscles based on the function of those muscles. It is different. That's where the critical thinking part comes in. It's you looking at the patient and understanding exactly why are you giving these exercises. And if you guys have taken another myofunctional therapy course in the United States, most of them, you agree with me that it's just a list of exercises, and they tell you, that's what I was told on my courses, go practice, just go try it, go, treat family and friends first, just start practicing, give these certain exercises and see what happens, and that's why we think that everybody's super lost after they finish a course, because you don't really know exactly why you're doing what you're doing, so for us to take a step back, look at the patient as a whole, and understand a little bit more the whole research behind myofunctional therapy. What is it? The muscle function, and what are these muscles that we're trying to work on? What are their roles with each different function? Breathing, chewing, swallowing, all of these things, very, very important. Dr. Katie Kennedy said, "You are all doing amazing work to educate on how important it is to nasal breathe. This is such an important topic." Thank you. Thank you so much. Kimmy's here. Hey, Kimmy. Lactation consultant. Airways are starting birth. Very important. Do you want to touch a little bit on lactation and the role of an IBCLC in the airway world?
Yeah, so we want to look, the IBCLC, to look at the tongue function during breastfeeding. If there's a restriction present, that's going to be more tricky. So having the tongue up and functioning correctly is going to help craniofacial growth. You talk a little bit more because you're a mama, so you have firsthand experience.
I am a huge breastfeeding advocate. You guys know that. So in order for the facial muscles to grow, or for the skeletal structure to grow, we need muscle movement. Think about it with me. If you go to the gym and you work out this arm every single day, but you don't work out this arm, what is going to happen over here? The bone here is going to atrophy. Why? Because there's no muscle movement. Muscle and bone need to work together. Well, we also have muscle and bone right here. So when a baby is first born, the mechanism of breastfeeding is going to help grow orofacial structures. If you guys have ever watched a baby breastfeed, just the motion and how much energy it takes. A lot of times, the mom gets exhausted and the baby sweating. A lot of times it just takes so much energy for them to be able to do that. And that muscle movement is actually helping. First of all, they have to nasal breathe whenever they are nursing. And then it helps maxilla and mandible. Everything grows. The mandible just follows the maxilla usually. But very, very important if somebody has an oral tie. So if there's a lip tie, if there's a tongue tie, just those structures are going to prevent the other muscles from doing what they're supposed to be doing. Therefore, it's going to impact breastfeeding. Breastfeeding is not just about the baby. You also have the mom and the mom's anatomy, and you have to make sure that both of them are going to work together. A lot of times, the mom's anatomy is going to allow a baby who has oral ties to breastfeed without a problem. A lot of times, the mom's anatomy, having a baby who doesn't have any oral ties, have a little bit more trouble breastfeeding. So working with an IBCLC is extremely important because they are the professionals on mama and baby feeding. They are going to be able to adjust. It's not just about oral ties. They're going to be able to adjust the different positions to make sure that baby can nurse. So if you're pregnant and you're listening to this, the number one recommendation as a mom that I have, go ahead and make an appointment with an IBCLC and talk about these things. Because breastfeeding is not something that we are born knowing how to do. It's something that's learned. So having the professional right there next to you to kind of guide you is the best recommendation that I have and that I wish I would have gotten whenever I was pregnant. Have you guys seen any movement in the US to create standardized education like we have in Brazil? There are. In university, it's very difficult. So Dr. Katie Kennedy said the same thing. Have you all considered contacting dental and medical school deans? It would be great to allow medical and dental students to take an elective course in their 4th year in myology. I'd love to help. Send me a private message if you don't mind. Anything that I can do to help grow this field, I will. I think that all of us here on Airway Circle, if you guys know the girls of Airway Circle, they're all volunteers within the Airway Circle membership. And we work insane hours to make sure that we get this information out there to the public and to other professionals. So anything that we can do to get more of this knowledge to healthcare professionals in general, we are here. So contact us privately. If you have any connections, any ideas, we would love to be able to help. Yes. Pediatric residents should do a rotation on this. Important to educate our young future doctors and dentists on airway health to know how to screen and know how to refer to patients. 100%. Yes, never forget the mama. Yes, longer nipples and tongue ties go unseen. 100%. A lot of times, we see adults with tongue ties that are insane, didn't you? You had somebody
yesterday.
They couldn't lift their tongue up whatsoever. And how do you go your whole life like this? We're compensating. Can you talk a little bit, Tamara, about what are some compensations that we might see with somebody that's extremely restricted?
Yes, sometimes it'll be limiting just jaw pain. I mean, if your tongue isn't able to move side to side when you're chewing, drinking, swallowing, then you're going to put pressure on the jaw joints, right? Side to side. So jaw stability. We also have rolled shoulders, forward head posture. If you put your head forward and you have a smaller airway, it's going to be easier to breathe. Open mouth posture, tongues down. You see these people walking around all the time. It's easy to see. Their lips are open, the tongue is down, and we just have low tone. So a lot of times the lower back will start to hurt because you're leaning forward. Think of all the pressure. Like, think of how heavy your head is and bringing your head forward and how much you have to hold that up instead of centered on your body. Think of all those muscles that are going to come forward. So like Renata said, working with other professionals, we need to know this stuff and how to look at it, and then also refer out for those people that can work on other parts of the body, making sure that myofunctional therapy can be more successful. But other things that might be a red flag, or if you're a snorer, breathing, the breathing portion of it, snoring is not normal. It's common, but not normal. Also just audible breathing, the way the chest rises and falls when you're sleeping, is it down lower, and it's very labored breathing. If you sweat when you're sleeping all the time. What other things? There's so many different things that can be contributed to low tongue tone, low tongue posture, airway concerns in the oral facial complex.
I'm going to share my screen with you guys now. Let me see if it's going to work, y'all. Let's see. All right. Let me see if you guys can see my screen right now. Can you?
I can see it.
Okay, awesome. I'm not sure what it looks like to you guys. Okay, right there. Perfect. Let me go back. No,
you can see the website, Airway Circle website, the Myofunctional Therapy University.
All right, perfect. So if you are a professional in this field and you want to learn more, here is our Myofunctional Therapy University. Our first course, Foundations of Orofacial Myofunctional Therapy. We do have a discount code that is good until July 15th. So instead of $26.99, you pay $23.99. It is 15 weeks on demand and live sessions. We're actually meeting every week during this course for 15 weeks. You guys are going to get to see us every Tuesday night at 8 p.m. Eastern is whenever we're meeting. 40 foundational exercises we're going to be sharing. I actually chose the exercises and I have 61, I think. So I'm trying to cut them back, not to overwhelm anybody, but you guys are going to have plenty of options of exercises and understand a little bit better when to use them. Here is Myobiz, that's completely on demand. So if somebody wants a little bit more help launching their practice or setting up their office, planning for therapy, selecting the perfect tools, this is already on demand and this can be taken at any time. Here's MyoCircle, starts January 1st. You guys can go ahead and join our wait list for that course. It's also on demand and we meet live every 2 weeks, but this is the course that blows your mind. So whenever you click over here on learn more, here's foundations. And here's the code. Okay, discount code for $300. It is OMT 300 altogether.
I don't think it went from.
Oh, it's not
Airway.
showing.
Yeah, when you
So I
click.
gotta stop sharing and share it again. So let's do. And you guys, if you have any questions about this, please just let us know. Let's see. Okay, this one now. Can you guys see it?
Yep.
Perfect. So Myofunctional Therapy University, here we are. Foundations, here's the discount code, OMT 300. You can just click on the link. Here are what some students have been saying about our past courses. We have about 60 hours of content for you guys over 15 weeks. Here are the modules. So module 1, the origins and essentials of myofunctional therapy. Can you talk a little bit about that, Tamara? We have Anne teaching that.
Anne is our SLP, speech and language pathologist, who is amazing. She has so much knowledge to share. Just learning where myofunctional therapy came from, because it's not new, honestly. It's been around for a long time. So many professionals, including myself, are like, I've never heard of this before. Like, this has to be new. So she goes into the basics of where it started, how it started, why it started, and shows you everything that you can know to tell patients really is, the community, where myofunctional therapy started. Because I get people all the time saying, I never heard of this. This is new. And you have to be able to say, no, it's actually been around a long time. Research is showing more and more and more now. So Anne goes into a deep dive on that as well. I think in that one, she might also go over orofacial dysfunction, or it might be the next one.
Mm-hmm. Yes, I think it's over here too. And then we have head and neck anatomy. So of course we have to review. All of us healthcare professionals have learned about head and neck anatomy, but we have to go back and take a deeper look into all of these structures, muscles, cranial nerves, cranial bones. Then we talk a little bit about dental anatomy. We do have healthcare professionals take our courses. We're not dental professionals. So really, really good for us to teach them these structures that they might not be familiar with. By the way, this is recorded. If you guys registered, you will get a copy of the recording very soon, as soon as it's over, really. Then we go, I can never say this word.
Stomatognathia?
Yes. So I say the Brazilian way, which is stomatognathia system, which is incorrect in English. However, this is, breathing, chewing, swallowing, speaking, everything that we do with the structures of the oral cavity. Oral ties. Tamara, you did this one.
I did. This was my module. I spoke on oral ties and knowing what are they made of? What is the frenum made of? Going into the cellular level of everything, looking at function, and making sure that we do more of a functional test than just looking at structure. So kind of bringing everything together as far as what does the tongue look like, not just the tongue, but how many ties do we have in our mouth? When is it an issue as far as a myofunctional therapy screening? But mostly what I liked the most was the cellular level of everything, to be able to have that knowledge to share with other providers and patients.
So there are only 3 studies out there that look at the physiology and the anatomy of the frenum. One of them says that you cannot stretch the frenum. In that study, they took excise tissue of children after doing a frenectomy. So they grabbed that tissue that they took off and they looked at the tissue, and the type of collagen fibers on there were the non-stretchy ones. There's another study that says, yes, you can stretch it a little bit, but that study used cadavers and they excised the whole floor of the mouth with the frenum. Well, there is collagen in the floor of the mouth that is a little tiny bit stretchy. We also teach a floor of the mouth release if you've done therapy before, and those are the little collagen fibers that we are releasing. So yes, if everything is super tight on the floor of the mouth, which is also going to be tight on your diaphragm and your pelvic floor, which is so interesting how it's all connected. So if everything is super tight here, it's going to impact the mobility of your tongue. That's where it comes to have really good education and understanding in all of these structures. You know, this is the foundational course, you guys. We're going to go very deep, very comprehensive into this. And I am going to mention now and later, we have decided to give all of our students lifetime access to our courses. We don't want to take anything away. You paid for this course, it's yours forever, because you're always going to keep going back to it. You know, there are things that you might go back about a year from now and you go, oh my goodness, I had no idea they said that. I had no idea what's in there, because it's a lot of information. That's why we decided to give you guys lifetime access, so you can always go back and learn, keep learning from it. Then, also on the oral ties module, I will be talking about my frenectomy protocol. So even if you're a brand new therapist, you're going to have a really easy guide whenever you get your first and your second and your third frenectomy case. You're going to know exactly what to do. What kind of exercises should you do? What kind of stretches should you do? How soon are you able to start therapy? How soon? What is the difference between exercises and stretches? You know, how about younger patients versus older patients? What are some other little recommendations that you can give in order for them to heal better, for them not to create too much scar tissue? And if they do create scar tissue, what do you do? So I didn't know any of this when I first started.
No, none.
At all. Alita looks is saying, this is amazing. I can't wait to join. That was my next question. Awesome. Yes. We're going, I think that this is the golden nugget of this course. It's the frenectomy, what to do before and after a frenectomy for each patient. Then we're going to go into the sleep disorder breathing. It's very important for us to understand everything about these disorders of breathing that exacerbate during sleep. So most of these people have disordered breathing during the day also. How do we recognize when somebody may have a problem and what to do to help them? What is the difference of UARS, sleep apnea?
Central apnea too.
Central sleep apnea. If you guys look at a sleep study, you're going to notice that sometimes somebody with obstructive sleep apnea may also have some central sleep apnea associated with it. So if somebody has obstructive sleep apnea, that is the breathing portion. That's whenever the airway collapses and he obstructs fully for 10 seconds or more in order to be considered an apnea. But what are central sleep apneas? And as a myofunctional therapist, can you help with them? Central sleep apnea is actually whenever your brain tells you to stop breathing. So in terms of exercises to strengthen the airway, no, because it's your brain telling you to stop breathing. But we do notice that if somebody has sleep apnea, obstructive sleep apnea, and they have that for a long time, slowly they start having central sleep apnea. So there is a correlation that if your body is going through the obstructive for so many years, eventually you're going to start having central. So if we can get these patients early and we can help keep their airways super, super healthy, maybe the chances of them developing central later in life are reduced. I'm not sure. Dr. Katie Kennedy said obstructive sleep apnea in adults is what has brought this important topic on the negative health consequences of chronic mouth breathing. And guess what? Children have obstructive sleep apnea too. It's not just adults. The issue is that we're not addressing these things as healthcare professionals early enough. So whenever we get these patients, there's already a fire, you know, we need to get these patients whenever we have some yellow flags, not even red flags yet. There are things that we can do to address those three pillars, the airway, the skeletal structure, and the muscle, because those working properly and working together, it's what's going to get this patient to have a healthier and longer quality of life. That's our main goal, to get people to feel better, to be able, you know, be able to do things and not be exhausted all day long. Nobody should live their lives tired. You know, we all need to be able to do things in life and be here and enjoy it. And if you can't breathe and if you can't sleep, we all know how, you know, what we feel like.
Renata, I think the other thing with the sleep disordered breathing is just having the knowledge. So when you're talking with their sleep physicians, that you understand what's going on, you understand what they're talking about, and then have that, you know, bridge the gap and collaborate for that patient too.
That's another key, you know, if you're just going into this field, you feel so afraid of talking to other professionals because you don't have all the answers and you don't have all the knowledge. Again, we're helping you guys build a strong foundation. And one of the things that Airway Circle is really good at is actually increasing your confidence. So if you gain the least whenever you are around us, that's going to be one of the things right there. You're going to become more confident. Module 7, OMT assessment protocol. I have developed a protocol. Is it the assessment or the treatment? Hold on. No, there's my treatment protocol. So this is the assessment, which is also developed by looking at 10, 12 different assessments of myofunctional therapy out there. I literally grabbed studies from or protocols from in Spanish, in Portuguese, in English. I put all of them together and we came up with our own full evaluation, an assessment protocol for myofunctional therapy. So you guys can, you know, it's very, very comprehensive. You guys can pick whatever you'd like from it. Medical history and screening tools. There are so many beautiful screening tools, including S.W.A.L.L.O.W.S. S.W.A.L.L.O.W.S was developed by Angela Richwine, who is not only our incredible friend, she is a myofunctional therapist in Virginia. And she did this, it's a myofunctional therapy assessment tool with Dr. Steve Lamberg. So she's going to present this actually next Thursday on Airway Circle. And guys, join us so you learn a little bit more about all the work that they put together and what each letter represents and how you can use this in your own practice. Then we go into consultation. You want to talk about the consultation?
So at consultation or expert guidance, the nice part is you get to learn from all of us that do everything just a little bit different, and you can take what you want and leave what you don't want. But at least you have different ways of therapists, the way they run their practice. So for instance, like Renata, I think mostly sees online now, which I used to only see online. In the last 2 years, I ended up getting a local office here in San Diego. I still see online. I have more of hybrid, but learning about the consultation, for me, I do it a little bit different. I have the patient come in. We do it all online, even if they're local, because it's just easier, especially if mom's there, or mom or dad without the kiddo. So then we can chat more about what we see, all the screening tools, what they filled out. I can ask more questions. So being able to see all of us in action, I think, and having us all together is invaluable, because when I took courses, it was always from like one person, which was also valuable, but it's nice to have like, oh, I like that. I want to use this, or I don't want to use that. So the consultation for me is just an online virtual thing that I do, that I review the medical stuff. I review all the signs and symptoms, and then I use it to educate as well. What is myofunctional therapy? All of that. So you'll get to be able to see us in action.
100%. That's what we carry that is different than anybody else on Airway Circle or Myofunctional Therapy University. You're not going to learn from only one or two people. These are several successful myofunctional therapists that are sharing a little bit of their knowledge with you guys. There's no other course out there that has so many different instructors. So if you, like I said, it's the perfect foundation. I'm telling you, I wish that I had this course
Yes.
when I first started. All of us are putting everything that we wish we knew, and this is after years of experience, years of working, of taking several different courses. We came up with something extremely strong that I'm just going to say it's going to be very hard for anybody else to beat. Nobody else will. Anyways, it's really, guys, you're going to be very, very happy that you started over here. Orofacial myofunctional therapy, full evaluation. After that, so the full evaluation is pretty much a consultation plus the assessment. And now, personally, I split both because if you go to a myofunctional therapist in Brazil, it usually takes about 3 days for them to do a full evaluation. It is so much work, so many things that we have to look at. So here I split into two. I do a consultation first when, like Tamara was saying, I look at all the photos. I can tell the parent or the patient what I'm looking at, how all of these things relate to each other. And then I go ahead and I do referrals the first appointment because I already know if that patient needs to have the skeletal structure address or the airway address. And then I do the assessment afterwards. The assessment is like, okay, I'm ready to start therapy. Let me see which muscles are working. Let me see how you're breathing. Let me see how mobility is. And based on those, chewing and swallowing, based on those, I develop my treatment plan. And then therapy recommendations. Oh my goodness, lots of good stuff. Everything you need to do to run an effortless and effective therapy session. What should you have with you? Because if you're just starting, you're kind of lost. And if you've only learned from one or two people, you're still trying to figure out, or you're going to be able to learn from several of us how we do things. And there's always somebody that you're going to be able to relate to in a little bit better. Mm-hmm. And then my exclusive treatment protocol. I developed this based on, again, all of the other courses that I've taken and the experience. And he explains a little bit better to somebody just starting or somebody that's been doing this for a while. How should we plan our therapy in a way that you start pretty much from the bottom up? A lot of these courses give you some exercises and they just tell you to try, but you don't really know that you're giving an exercise that should never be given in the beginning of therapy. So this protocol kind of guides you. Okay, this is where I should start, because if you don't have a good foundation, you're not going to be able to get fast results, or better results, or results that last. So that's pretty much what the treatment protocol is going to teach you. Then we go into the exercise. Like I said, I have about 61 of them right now. I got to cut them down a little bit, or I may not. I don't know. I might leave about 50. But come take a look. And all the exercises have videos. You guys are going to have very well explained videos. And why are we doing these exercises? Which types of patients are we going to use these exercises with? Oh my goodness. And did this module right here, navigating levels of research in myofunctional therapy. Tamara and I can attest to you guys, we did not learn any of this in our first course.
No, not in our first course. Definitely not.
Can you talk a little bit about the levels of research?
Yeah, so Anne, she's amazing. She went through all the different levels of research, broke it down. It's about an hour long of just, what do you look for? Is it good research? Is it okay research? Because when you're sending stuff to other professionals or even patients who may have a scientific background or want to know the different levels of studies, you want to make sure you're not getting something that's just not high level research, because they say, well, that's not high level, right? So you want to be able to know the difference and what to look for and able to feel more confident in giving that information to others.
And then we go to some extra resources. If you'd like to learn more, podcasts that are out there and books and pretty much what are other ways to immerse yourself. with knowledge, because like we said, it's very important for you to learn from all different places to become a well-rounded clinician. But there's more. So for everybody who signs up for foundations, you're going to get a whole year free of the Airway Circle membership. It's a $450 value. Like I said, we have hundreds and hundreds of lectures available for you guys to learn more from. We have speech pathologists, we have chiropractors, we have sleep doctors, so many other professionals that come and talk about their specialty and what they see in a patient. And myofunctional therapy works because we're not just giving the patient exercises, we're looking at the whole picture. But in order to be able to understand what we're looking at, we need to learn from others. So Airway Circle membership free for a whole year. You guys are going to get the myofunctional therapy screening swallows from Angela and Dr. Lamberg. She's going to explain exactly what that means. She's going to give you guys access to the form. And then brochures. If you guys are not aware, with Airway Circle, we have developed some incredible brochures. We have 7 of them. It's on our website. If you guys go to airwaycircle.com, take a look at all of the brochures that we have. You guys are going to get 100 what is myofunctional therapy brochures to get your business started. That's about $100 value. And yes, we have a promotion. So $300 off taken right now. Just click on the link to get the discount and you guys will be directed to the page. So here are some of our mentors and the girls who are all behind Airway Circle and foundations. So it's me, Terma, Angela, Anne, Madison, and Kimmy. Our guest lecturers, guys, we have Nicole Goldfarb talking about sleep, Christy Gatto talking about muscles. And if you guys have not seen yet, please go check Christy Gatto's courses. She has some of the best courses in myofunctional therapy in the United States. She is the author of a book about muscles. She is a wealth of knowledge. So if you've taken a few courses again and you want to know more about muscles, please take a look at Christy's stuff. We have Mary Francis. She's going to be talking about oral habits. And Melissa is going to be talking about oral restrictions and breastfeeding, how all of that is related. Like I said earlier, in myofunctional therapy, we do not treat babies usually, but they do need help with pre and post frenectomy care. That we need to work with IBCLCs with that. But it's very important for us to look at the whole picture and have knowledge about everything. We have a couple bonus lectures. Dr. Paulo Suarez is an incredible orthodontist, MyoBrace certified provider and educator. He's going to be talking about airway and myofunctional therapy orthodontics using the MyoBrace system. And you guys know our beloved Dr. William Harrell. He is a board certified orthodontist, dental sleep medicine. He is an author. He has an incredible book coming out very, very soon. He's part of the ADA task force. The American Dental Association has put together a group of incredible professionals to develop screening, and they have a form that they're coming up with for us dental professionals to screen these patients of sleep disorder breathing and be able to refer them to the right professional. But he talks about what influences craniofacial growth. So it's all about craniofacial growth. That is why this course is also great for dentists. Anybody wanting to learn more about airway, it's not just a myofunctional therapy course. It's not just a myotherapy course and this is how you do some exercises and go with it. This is a very well-rounded, put together course that's going to increase your knowledge in more ways than you may be aware. We have some questions over here on the bottom of the page. So how long is the course? It is 15 weeks long. So it's about 3.5 months. What is the time commitment? Some of our modules go from 30 minutes to 4 hours. Total of 60 hours after we add our lives into it. You can watch and rewatch all the recorded videos on your own time. And then we have our community Facebook, and we have the WhatsApp group also. How long do I have to access the content? We are giving lifetime access to everybody. There's also many PDFs and presentation slides that you guys can download. when are the live sessions? So class go lives on August 1st, and we're going to meet every Tuesday at 8 p.m. Eastern Standard Time. If you are in a time zone that you cannot be available that time, or for some reason, if you have to miss one, it is totally okay. They're recorded and put into the course immediately. I have taken an intro course. How is this one different? Will I benefit from foundations? So everyone in this field, like we said, holds a little piece of the puzzle. The advantage that you have with foundations is the fact that you will have 6 mentors. These are 6 successful myofunctional therapists that will be there to guide you and offer their perspective. This will also be the longest and most comprehensive course you will ever find. Will I have access to a supportive community of like-minded therapists through Foundations of OMT? Yes, we have a private Facebook group and a WhatsApp group just for our students. Feel free to message and ask questions anytime you need help. This is where Airway Circle prides themselves. You will be a part of a true community of professionals who want to see you succeed. And again, do you offer a payment plan? If you guys haven't seen this, we do offer a payment plan in 3 installments. Of course, we do not want the upfront cost to prevent anyone from becoming a myofunctional therapist. We need more of you to be out there helping these patients. It's estimated that only 15% of people who have sleep apnea are actually diagnosed. With those, only 10% are being treated. We think that there's about 25% of patients going through dental practices right now that have an airway disorder. If you can be the eyes behind, the screening of these patients and be able to guide them and then help them in such a different way. Being a dental hygienist myself, it was extremely gratifying to be able to help people with their oral health and so many more things that we do as a hygienist. However, when I realized that I could change somebody's life, that's when I was immediately sold. But we need more of us. Mm-hmm. And then can I purchase all 3 courses with a payment plan? So actually, this is something new that we are offering. If you would like to join Myofunctional Therapy University, let me stop sharing. If you'd like to join Myofunctional Therapy University and take advantage of all 3 courses, there's actually a 14-month payment plan. So you can start now. You're going to have 14 months to play, and you have all 3 courses. So we start with Foundations of Orofacial Myofunctional Therapy. Then you have MyoBiz. Then you have MyoCircle. So well-rounded in about a year. You don't need anything else, literally, after you take those 3. Anything to add, Tam?
Amy is saying this sounds a bit more advanced and comprehensive than an intro foundations course. Looks great.
It is a little bit more advanced. So that's why we also made it 15 weeks, because we need time to process what we learn. We need time to apply what we learn. It's not only process and learning, you have to be able to apply. I came in late. Will you send the replay of this meeting? So yes, anybody who registered for this meeting, I think that you can still register if you go to the Airway Circle Instagram link. If you click on the link, you can still register and you get a copy of the recording. We're also going to replay this on Thursday. So if you miss and you want to watch it live again, join us on Thursday. We're going to be presenting swallows with Angela, and then this lecture, this meeting again. If you guys have any other questions, please let us know. We are super excited to start Foundation. Starts on August 1st. So the course opens August 1st, and our first meeting is the following Tuesday, where we get to meet everybody who's signed up for the course. We want to know where you're from, what your background is, what do you hope the most with, taking this course. If you have any other specific questions, please reach out to us. Tamara and I will be happy to answer any questions that you may have. There may be some doubts that you're not comfortable sharing publicly, so please message us privately. We are here to guide you and to help you. Because like we said, our main goal is to help more patients. So we need your help.
We do.
to get to more people. All righty, everybody. Click on where's the QR code? It's not around me anymore. Tamara, you have to do it. Click on the QR code. Take a look at our page. And we hope to see you on August 1st. Take advantage of the $300 off. If you have a group wanting to sign up together, reach out to me. If you have 2 hygienists in your practice, or your 2 hygiene friends, and you want to sign up together, please reach out to me. And we see if we can do something special for you guys. All right. Thank you, everybody. Have a wonderful Saturday, wonderful weekend, and we cannot wait to see everybody on Foundations of Orofacial Myofunctional.
All righty, bye.